Hello，Hello。
哎，你好，你好，你好。
啊，
OK，呃姚教授，那个刘教授大概是还有他准备好了吗？那边
我打个电话
刘
再给他打。
刘热是在这儿的。
我进来了，
？OK OK，
来，
刘烨进来了是吧？那
对，
我开始吧。那个我把严思燕也拉进来了。
好，
刘烨，
OK，so can we also shall we begin?
Yes, let's get started.
All right. So just after I do the introduction, Oza is going to assign me as the interpreter, so I can translate between English and Chinese for you guys. And then we'll first hear Professor Liu's speech, and then we'll hear from Mark. So there's going to be quite some interpretation going on. Just bear with me. Okay. And I'll do the introduction. So, hi everyone. This is Jonas, and I am honored to introduce our speakers on behalf of Hopkins Asian Medicine Student Club. Today, we'll first hear a talk by Professor Liu Baoyan. Professor Liu is the president of the World Federation of Acupuncture Societies, and he has held multiple positions in the academia, including the executive vice president of the China Academy of Chinese Medical Sciences. Currently, Professor Liu is in Hainan province. We'd like to deliver our sincere appreciation to Professor Liu for participating in our event in such a busy time. Also joining us is Mark Sodders. He's a senior clinical and translational research fellow from the University of Washington. And Mark will talk about his recent research project. Also, we also have other guests from China. We have Professor Yao, who gave a talk to us 2 weeks ago. I'm sure that many of us still remember him. And Professor Liu will be delivering his speech in Mandarin Chinese. So if you would like to listen to his speech in Chinese, you can just stay on the main channel. And if you like to listen to the speech in English, please turn into the interpretation mode, which Oza will provide more detail for.
Yeah, so I'm gonna explain the interpretation stuff right now. So if you would like to listen to Professor Liu's speech in Chinese, just don't do anything. But if you want to listen to English, you would select the English in panel in the interpretation, so you will listen to only Jonas' voice. But also make sure to click on mute the original sounds so that you will only hear Jonas speaking, so you won't get overlap between Professor Liu and Jonas. So is there any questions about
just very briefly, let me explain this part in Chinese to our professors. So 刘教授和姚教授，我们待会儿开始讲之后呢，刘教授您就用中文讲就可以了。然后会说中文同学们就会直接听您说中文，然后不会说中文的人，他们会只听到我来翻译和念这个 PPT 上的内容。So do you have any more questions？ 还有其他问题吗？
Okay, so I'm gonna hit start. 我现在开始了，然后 so right now you should be able to switch to English to listen to Jonas translating if you need to be.
Okay, maybe I can share my PowerPoint.
可以，对，刘教授你可以 share 你的 PowerPoint。在下面那个有一个绿色的按钮。
对，我看到，但是我要找一下那个东西在哪。
好。
因为我用的是一个网络版的，它这个东西看不到我那个东西，比较麻烦。是个网络版的，怎么？
不是，你应该在顶上看看有一个条，共享屏幕。
我知道，但我用的是网络版的那个什么，没打开那个什么，所以它这个网络版的话，我已经打开我的 PPT 了，但是它里边看不到。你看这个东西。
那你这样子能不能让 Jonas
放？对，有了，
让 Jonas
有了。
好，可以。
啊，可以了吗？
可以了。
你放全屏。
对，
你放全屏。
到时候你放那个就是播放的那个。对 ，OK。
可以了吧？
可以了。
Good night. My name is Liu Baoyan, come from the China Academy of the Chinese Medical Science. this the presentation is a research progress of acupuncture and mouthpartition therapy for brain disease. Maybe I speak the Chinese. You can look at this English the PowerPoint. Okay. 其实，在2016年的时候啊，中国当时发布了一个中医药的白皮书。那么在白皮书里边吧，专门就中医药这个它的一些特点在这个白皮书里边进行了这个介绍。那么针灸也是中医药非常重要的这样一个领域。那么针灸它是中医的一个组成部分，但是吧，它的这个作用的途径作用的这个方式、适应的范围和我们的那个和药物它是完全不同的。所以那个我们经常说，那么针灸是中医的一个组成部分，但是吧，针灸是中医药里边精华子的精华。那么针灸在这个我们古人经常在针刺的时候有一句话叫针刺之药在于治神针刺之针在于治神。那么这个治神的这个含义很大程度上，那就是说我们对这个用针刺要起到作用的话一定要有这个患者的这个心理的作用和他脑神的这样的一个响应，你才能够真正的起作用。所以说治神，也就是对针刺这个脑的这样的一种反应，对针灸的效果来说是非常非常关键的。那么我今天利用点时间因为我想这个有关针刺和脑的这种研究在中国其实也有很多这方面的研究我今天想利用咱们点时间，就中国针灸杂志它上边所登载的，在近10多年来登载的有关针刺和那个脑的功能的一些文章，跟大家进行分享。因为我也作为这个中国针灸杂志的这个主编，那么针灸杂志在中国针灸杂志在国内它是一个就是综合性的这样一个针灸的一个杂志。但这个杂志它以那个临床研究为主体，同时也有一些和临床相关的尤其是和在人身上所做的一些基础研究。那么这个杂志它也被美国 Medline还有这个其他的一些索引的一些机构都可以索引到。所以在 Medline 里面可以看到中国针灸所发表的这些文章。那么在中国的脑计划里边如何利用针灸对脑的影响来研究脑，那么在这个方面其实一直是我们在探索的一个问题。那么中国针灸杂志从1981年创刊到2017年这个当中这37年当中，一共发表了16499篇这个文章。那么其中针灸治疗脑病和脑相关的文章有1321篇。那么这些文章它涉及到了穴位对脑功能的影响，以及针灸防治脑病，从脑来探讨针灸的作用机制等等。那么展现出了穴位刺激与脑的这种关系是非常密切的。 那么穴位的刺激啊，它可以整合和调节脑的功能啊，这方面的一些研究啊，充分显示了这方面的内容。那么下边吧，我就这个经脉针灸啊和脑的一些关系啊，给大家做一个简单的介绍。那么从脑，在这个中医里边吧，它有五脏六腑，而脑并不是它的一个主要的不是它的五脏六腑之一，而是在中医里边吧，他们认为心主神灵，就是人的这个精神活动啊，主要是由心来主的。那么他并没有研究，没有充分的就阐明脑和神灵，咱们和那个精神和人的状态之间的关系。但是在这个《内经》开始啊，就有一些论述啊，一个就认为脑为水海啊，水大家知道它是先天所产生的，那么水海，那就是说它是一个什么呢？人体先天之精的一个精华之所在。再一个吧，在那刚才说，在五脏六腑里边啊，并没有把脑放在其中，但是在《内经》里边也说到，脑为奇恒子府，也就是说它是一个奇恒子府，它尽管不是五脏六腑之一，但它是奇恒子府。那么通常有4条经脉啊，直接和脑它是相连的。那么其中包括了足阳明胃经啊，还有足太阳膀胱经啊，再有这个督脉啊，还有荞脉，这4条经脉的它的经脉的起止啊，这个都和这个脑啊有非常密切的关系，可以说直接啊和脑相连的。那么和脑相关的一些论述啊，在古代也有很多，比如说这个气阶的理论啊，还有这个四海的理论啊，再说木系还有我们说这个脑内的一些经脉啊等等。那么这是古人在这方面嘛，可以说他对脑的这个经络的联系啊这方面嘛，它有非常丰富的这样一些内容啊，那么对脑和它的这些功能和经脉的联系啊，到底是有什么意义呢？我这举个例子，是中国中医科学院这个朱斌研究员，他在这个2014年的时候啊，曾经发表一篇文章，主要说在中国古代女子都要裹脚裹足啊，就那个缠小脚。那么这个裹足与这个经络理论啊和脑科学有什么关系？为什么古人要这个裹脚？那么他从经络的角度啊对这个问题啊进行了阐述。他认为啊，他们经过从解剖上从各个方面的研究啊，他看到就是我们的这个足厥阴肝经，它是起于大趾啊，起于大趾，足就是那个脚的大拇指。那么这条经脉吧，它扰阴气，就是往上行走啊，在外阴这地方扰阴气，与生殖器官啊、性欲啊也相关。而这个在大脑皮层，这个足就是咱们说脚的这个角度啊，就是拇指这些地方，它与这个性以及生殖器官在大脑皮层它是相连的，在同一个大的区域内，它是相互有连带关系的。那么这个裹足，它可以主要是让足，就咱们大拇指的皮层的域，它这个皮层当中啊，就是和足大拇指啊这个地方这个皮层这个域啊，它费用性的萎缩，通过裹足以后啊，让它费用性的萎缩， 而在这同一个区域当中，它的性、它的生殖皮层域的代偿性就会增大，它的代偿性就增大了。那么通过这样的一个增大，它实际是提升了人的这个性感的作用啊。那么这个和咱们目前啊，大家穿高跟鞋啊，这个机制啊，有相同的这样一个机制。那么这样一个研究，其实不光是在这个足厥运肝经看到了，就是我们现在吧，大家看到就是说，如果在面口的一些疾病啊，我们经常用这个手的大拇指啊和这个之间，咱们有个穴位叫那个什么合谷穴。那么合谷穴，咱们说面口合谷收，为什么用合谷穴这个针刺可以治疗面部的疾病呢？大家也发现，就是合谷这个部位的它的皮层的部位上和面部的这些部位啊，它是在同一个区域当中啊，所以如果我们通过这个合谷穴的针刺啊，它实际可以直接影响到面部啊这些部位的功能的调整。那么这样的研究也充分显示了，就咱们这种古人所发现的这些经络的一些连带，其实它和脑啊有非常密切的连带关系。也正因为这样的一些连带关系，也给我们针灸的一些治疗奠定了非常好的一些基础。比如我们经常用足厥运肝经的一些穴位啊，来调整人的一些生殖功能啊，用合谷穴来调整啊面部，治疗面瘫，治疗这个牙痛啊，治疗这个就面部啊这个部位的一些不适，我想它都是有一定的这个基础的。当然这些研究啊，我们也希望能够进一步的深化啊来研究。当这个功能核磁啊出现以后啊，当功能核磁出现以后吧，这个在咱们这个针灸的杂志上啊，也发表了一系列的文章，来让大家通过这种无创性的功能性的核磁MRI 啊，来展示啊针刺以后它对脑的一些影响。那么这篇的文章吧，我们一共看到啊，一共有这个18篇这样的文章，到17年啊，从81年到2017年，一共有18篇文章。那么这些文章吧，它的这个研究吧，涉及到4个方面啊，涉及到4个方面。一个方面就是穴位，这个它的特异性的一些研究。所谓的特异性，就是我针刺某一个穴位的时候，它是不是经常性的在某一个方面起作用。那么另外一个就是咱们中医里边我们经常叫的针刺要有得气啊。那么得气吧，它不是一种疼痛，就是你针刺以后人体的一种反应啊，一种感应。那么这种感应，那么通过 MRI 啊可以看到啊它的这个功效特点到底是什么。那么在针灸里边我们经常说啊，就是气滞而有效，你要扎针啊有感应了，你这个效果才能出现，如果没有感应，那你的效果可能就非常差了。那么第3个方面就是从脑功能的角度啊，客观的反应上来观察不同的刺激对脑的所产生的这个影响啊，这些不同的穴位刺激啊，它对脑功能影响的一些部位，影响的一些内容到底是什么啊？它们之间的差别有没有？那么第4个研究啊，就是主要是在临床的方面的一些研究，通过脑功能成像下来看咱们针刺这个效应到底和脑的这个功能是怎么相关的。下面吧，我就分别对这几个方面举些例子给大家做一个简单的介绍。首先大家看到的这篇文章 是在那个2003年由这个引领教授啊发表在我们那个中国针灸杂志上的。那他主要是用这个 PET 脑功能成像研究了针刺足三里这个穴位以后，脑功能尤其是葡萄糖代谢的一些变化的一些情况。那么他的这个研究他是那个咱们大家看到他是选了男性的健康的志愿者给他在右侧的足三里穴给他进行针刺足三里穴来进行针刺。那么针刺以后来看这个 PET， 通过这个 PET 这个脑功能的成像来看这个脑内葡萄糖代谢这个率变化的一个实验。那么获得了脑功能变化的这个研究可以让我们看到了就是针刺以后脑功能的一个可视性的这样一个实验的依据。那么这个研究它得到的结果是什么呢？就是针刺右侧的足三里穴引起的视丘下部、尾状核头部还有小脑、颞叶中央后回、脑干的葡萄糖代谢增加葡萄糖代谢是增加的。也就是说针刺足三里穴可以引起与内脏功能有关的皮脂下的植物神经中枢它的葡萄糖代谢的增加。那么这也可以来用这样的方法可以进一步来解释我们针灸治疗的一些效果这是咱们说这个文章它是从经穴的这个作用这个角度进行的研究。那么另外一个研究它是选了就是神门和大陵两个咱们经常用来治疗和人的神志睡眠相关的一些这个疾病的。那么他用这两个穴位分别在这个右侧的大陵穴和神门穴进行那个针刺。他也是选的这个健康志愿者那么针刺以后，在这个 MRI 下采用这个组块刺激模式进行扫描，那么获得了这个相应的这个结果。这个结果显示这个就是大陵穴它可以特异性的激活这个自主神经功能支配的区域，而这个神门穴它可以激活情绪控制等区域那么两个穴位的效应它是各具特异性，也就是两个穴位虽然他们可以说是几乎在同一个阶段但是他们的这个效应的结果它两个是不同的。那么而且这两个穴位在我们针灸的临床应用当中，它往往它治疗的范围也是有所区别的。它就说明了这种穴位的特异性它是有一定的这个脑功能基础的。那么同时他们还做了咱们这个另外一个研究做了针刺脑功能成像的个体差异的一个初步研究。也就是说我们同样刺一个穴位，而不同的人他的反应区域是不是完全一样。那么从这个研究里边也可以显示其实由于人的这个个体差异不同，你即使刺同一个穴位同样的刺激，它往往的这个脑的激活区其实还是有很大的差别的。这给我们针刺的个体化治疗这个提出来要求了，就是为什么我们针刺往往要求要个体化治疗，每个人同样的疾病但是你要在针刺的时候 要根据不同的这个情况来选择穴位，或者选择针刺的方法啊，奠定了一定的基础。那么另外一块吧，就是我们在这个杂志上大家看到啊，有很大的一块是就针灸治疗脑病啊的这样一个研究。那么所治疗的脑病吧，可以集中在这么几个方面啊，有脑卒中、帕金森氏病、抑郁病、癫痫、颅脑的损伤、小儿的脑瘫啊、阿尔茨海默氏病，还有血管性痴呆啊这些疾病。那么对这些疾病啊，用针刺的能取得什么样的效果啊，或者它对脑有什么影响啊？那这些研究啊，这方面都做了不同程度的一些研究。首先我们看一下针刺的这个脑卒中啊这样的影响。那么针刺啊来治疗脑卒中，咱们这份的文章啊比较多，我们看到的一共是发表的文章有467篇啊，那么其中有57篇是具有这个代表性的啊，有代表性的。那么这些研究吧，这57篇都是以临床研究为主，那么同时吧，他也做了一些基础研究啊，从这些文章里面它可以体现出来，针刺治疗脑卒中，它有这个以下的几个方面的特点。一个方面就是针刺对脑卒中的不同分期采用不一样的针灸干预手段，那么体现了针灸干预啊，它这个手段的多样性，这是一个方面啊，就是针刺的方法其实它是很多样的啊，我们用这样的方法吧，这个研究啊也显示了在不同阶段，比如说急性期啊，在这个恢复期，在这个康复期，那么针刺的穴位啊往往可能有所差别，方法也有所不同。那么第二个方面就是针刺干预脑卒中的观察的指标越来越可以就是客观的反映它这个效果了，就是我们从观察指标上也进一步进行了优化选择。那么第三个吧，就是针刺治疗脑卒中的这个时机，在什么时间来扎针啊？它的和疗效有什么关系啊？这方面的研究也做了这方面的一些研究。那么同时对一些名老中医，就是我们一些老的专家，他们用针刺的方法来治疗这个脑卒中。那么这些脑卒中给我们的这个，因为他经验丰富，那给我们这方面的有哪些启发啊？在这些文章当中也有一部分是体现了这个方面的。另外一方面，除了常规的针刺方法以外，像全息针灸治疗以及一些刺法应用针对一些症状它针对某些特殊的症状显示出来很好的一些疗效。比如说我们在针刺当中经常见到的吞咽困难那么这样的一些临床的表现还有一些就是这个手的一些痉挛、拘挛这类些情况等等吧还有说我们在触纵下边的尿失禁这些，那么用针刺的方法往往也可以取得非常好的效果对这方面的疗效，对它的针刺的方法都进行了研究。另外一块吧，就是关于针刺治疗脑卒中到底现在是咱们说进行的这个量很大，咱们临床当中尤其在住院的病人当中很多的这个病人都是接受针刺的。那么怎么能够用更加科学、更加规范的方法来评价它的效果？这些方法学其实也进行了很好的一些探索。那么再一个吧，就是对这个帕金森氏这个病，这个病吧，咱们在这个中国针灸上 一共有37篇文章的发表。那么我们对这37篇文章当中的14篇文章啊进行了筛选出来吧，认为它的质量啊它有代表性。那么它那个反映出来的特点啊有以下这么3个方面。一个方面吧，就是基础研究，咱们多采用电针干预的方式啊，关注的靶点主要在大鼠的黑质和纹状体。那么电针可以促进多巴胺的合成与再次的提取摄取，所以它对这个帕金森氏啊有一定的作用，可能和这个有一定的关系。那么另外一块吧，在临床研究方面啊，咱们往往是把针刺的方法和药物治疗的方法啊，给它联合起来进行应用啊，但是很少单用针刺来治疗的。那么还有一些专家的经验也给大家很多的启发啊，如像这里边那个咱们说那个叫腈8针啊，就是在头部啊头8针，头部选了8个穴位啊，对这类病人啊进行针刺，那么他取得了相对来说比较好的一些效果的苗头。那么另外一个病啊，就咱们说抑郁症，这方面发表的文章啊，一共是33篇。那么对这33篇的分析啊，显示啊，针刺治疗这个抑郁症啊有2大特点。第一，针刺治疗这个抑郁症，它的治法和手段是非常多啊，它不是局限在某一种上啊，它有手针，有电针，有穴位埋线，有隔药灸，有针药结合、针管结合等等，所以它的方法很多样啊，这是一个特点。第二个吧，就是针刺治疗抑郁症可能起效的机制在于调节下丘脑、垂体、肾上腺皮质轴。那么这个也为我们针刺功能这个轴啊，在针刺的干预下，它可以逐渐的恢复常态。那么这可能也是我们就初步的一些发现啊，为抑郁症的进一步的针刺治疗也奠定了一个很好的基础。有关癫痫的这个发表的文章啊，一共有49篇。那么我们把其中8篇质量比较好的文章拿出来啊，进行了一个归纳。那么显示出来以下2个方面的这个特点。第一，就是癫痫的针灸治疗以穴位埋线联合康复或药物为主，也就是埋线的方法在治疗癫痫当中效果比较明显。那么另外一块就是耳针干预癫痫是一项非常有前景的这样一个研究。那么它这个吧，主要通过迷走神经刺激来，因为耳区的这个迷走神经，它直接可以和脑内的迷走神经这个有关联，所以通过这个耳甲区的迷走神经的刺激，它可以调节迷走神经来影响大脑的功能，那么这样有抗癫痫的作用。那这方面的工作这2年也有了很多的一些进展。而这个血管性的痴呆，那么这个方面的发表的文章是26篇。那么对这26篇的这个归纳，可以说也可以看到它有2个特点一个是治疗血管性痴呆常用的针灸干预措施，往往是用电针或者是穴位主要是集中在头部，所以经常选的穴位像这个百会、水沟、神门或者头针的一些穴位等等。那么另外一块嘛，就是评价针灸治疗血管性痴呆常用的观察指标我们发现大部分都是用的那个量表的方法比如像咱们日本的这个长谷川 这个痴呆修改量表，还有我们那个社会活动功能的调查量表日常生活能力的量表等等，作为我们这个针刺治疗这个血管性痴呆的一些那个效果的一些监测。
刘教授，不好意思打断一下，就是我们可能因为还有下一位的演讲，所以我们可不可以快一点，大概2-3分钟？
好吧，
结束。
好吧，那具体的那个内容我就在这儿不详细的那个什么了，大家如果感兴趣的话，将来可以看一下幻灯。那么这边有关这个阿尔海默斯病还有关这个小孩的脑瘫的治疗，以及这个创伤这方面的这个针灸的一些治疗引起的那个植物人什么这一类的那么总之一点吧，就是针刺对脑功能的影响，我们觉着还是非常有明显的证据的。那么这方面的研究尽管大家已经做了不少的一些临床和实验的研究，但是真正要建立起来这样一个体系，我觉得还需要我们大家共同来努力的来进行探讨。所以我今天的这个报告就到这儿谢谢大家。
好，谢谢刘教授。Okay, Jonas, I think you're back. 谢谢
I'm back. Thank you so much, Professor Liu. That was really great. And so I guess actually I think we're going to hold all the questions and discussions for the end, right?
Yeah. Or if anyone has any urgent questions right now, you can ask that and put it in the chat or something. But let's get started with Mark. Yeah, you ready?
Yeah, let me share my screen here. Okay. Think you should be able to see my slides now.
Yep.
All right. Okay. Well, first of all, thank you, Professor Liu. That was excellent. And a lot of that research actually forms the basis of what was written into the support for my grants. Anyways, we want to talk about that here in a little bit. But I really enjoyed the presentation. Thank you for that. So today I wanted to introduce myself and introduce my line of research. I'm Mark Sodders, and I am an acupuncturist. I have practiced acupuncture a little over 15 years now. I've studied it for about 20 years. And recently, I decided that I wanted to, work on the research end of things, meaning that, here in the United States, in the healthcare system that we have here, in order to assimilate integrated medicine, and I use that term broadly, but that includes acupuncture. In order to assimilate integrated medicine into the dominant culture of healthcare in the United States, we need an evidence base. And quite frankly, the evidence base for acupuncture, as it relates to the United States for United States citizens, is there's a paucity of research. Everything is driven by this evidence base. So your insurance, reimbursements, credentialing in hospitals, all of that is driven by an evidence base. And so I felt that it was had some opportunities open up for me, and I felt I would take it to help be a part of the handful of individuals here in the United States working on acupuncture research to work on building that evidence base. So currently right now, I've been funded by the NIH, particularly the National Center for Complementary and Integrative Health since the end of 2016, so about 4.5 years now. The first part of the grant you see is a T90 program that was through the School of Nursing at the University of Washington here in Seattle. And that grant's still ongoing, actually. And any person who has the terminal degree in acupuncture can apply for that T90 grant. It's called the Bridge program, Bridge without an E. It's building research across oh, there's so many acronyms in academia. This is why we use acronyms, because we can't remember what it really says. Anyways, you can look it up. T90 Bridge Program, UW. Basically, it's a 2 to 3 year training grant funded by the NCCIH, wherein people with integrative health degrees, the terminal degrees, are able to apply. And the goal is to see if individuals who have this sort of integrative health degree, in the absence of other types of science or research training and education, can in fact be trained in research. So I did that, and it was a great experience. And I thought I was going to be done with that and go back to private practice. But the NCCIH opened up another funding opportunity for individuals who have essentially just a terminal degree with an integrative health degree. Again, that's acupuncture, chiropractic, and other forms of non-conventional medicine degrees. And this is where you see that it's called the KL2. The KL2 is a specific type of career development award. It's more of an institutional award, meaning that Johns Hopkins might have somewhere a KL2 funding mechanism for some sort of discipline. Here, through the National Center for Accelerating Translational Science, NCATS for short, there were 4 positions throughout the country for this KL2 for people with integrative health degrees. I decided to apply for it, and I got it. So I transferred from the School of Nursing to the School of Medicine, and I have been in this role as a KL2 scholar for about two years now, and have a year remaining on this grant. Now, this is important because what I wrote the KL2 on is I wrote this on the premise of conducting an acupuncture study to examine feasibility of that intervention among persons who have chronic traumatic brain injury. So first, I want to just give credit to my mentors. These are the current KL2 mentors. Ryan Bradley, he's an MD. He's the Director of Research at Healthcott Research Institute. There's Monica Vavilala. She's Professor of Anesthesiology and also the Director of Harborview Injury Prevention and Research Center, which is sandwiched between Harborview Medical Center and UW Medicine. And if you're not aware of what Harborview Medical Center is, it's a level 1 trauma hospital that serves the 5-state region up here in the Pacific Northwest. And also Jeffrey Dusick, who's over at, he's Director of Research over at the Conrad Integrative Health Network. Now, I just want to give a quick little plug here. HIPRC, Harborview Injury Prevention Research Center, they have a yearly program for high school students and undergraduate and graduate students that these students can come to the center. It was online last year, it's online this year, and participate in conducting some research studies with some of their mentors, and get some experience, some immersive experience in research. That's something that you might know somebody who's interested in. Please feel free to go to hiprc.org and look for the Insight program. At any rate, back to this. So this is what I wrote the grant on. The grant was to take a look at adults with traumatic brain injury, but there, in the United States, when we come to public health funding, we need to find an area where there's a gap. We need to find a gap where we can say that acupuncture might be of help to certain individuals. Now, because of that, most of the acupuncture funding, specifically acupuncture now, not just not integrative health funding, but specific to acupuncture, the focus has been on pain, all sorts of pain. And pain, oops, there must be some sort of timer on my slides, but pain is of interest because it's, believe it or not, it's only been recently that the NIH has started funding research to look at pain as kind of its own condition. Historically, pain has been viewed as, well, it's a symptom of something else. So if you study that something else, you'll address the pain. Well, that's changed. And now pain's being viewed as its own separate condition that needs to be studied. So acupuncture, tends to do quite well with pain. And so that's a good area which all sorts of funding can occur, and that's happened throughout the country. So, but what I wanted to do was to kind of take that a little bit further. I wanted to look at something a little less non-specific. And that's when I realized that there's an opportunity here based on my prior clinical experience of working with individuals with brain injury, but specifically from an external force, so a traumatic brain injury. It turns out that these individuals, once they go through their rehabilitation, once they go through the ICU, then they may go to a nursing facility, they may go home, but they have some sort of rehabilitation. After that period of time, there is a real lack of surveillance for this population. And nobody really knows the extent of how traumatic brain injury is impacting these individuals. This has been a push within the medical world in general, particularly in the United States for the past few decades or so. This has led to the what's called the TBI model systems. TBI meaning traumatic brain injury model systems. Basically, it's referencing a longitudinal study where people who are admitted to the hospital with moderate or severe TBIs are asked to enroll in their cohort, and then they meaning the TBI model systems then follows them through time and follows on various types of clinical outcomes. And really, it's the first it's really the first attempt to try to find out what's going on with these individuals in the long term. To put it shortly, once somebody has the injury and they're stabilized, and whether or not they have to go to a nursing facility or home, it's metaphorically like, bye-bye, call us if you need something. And those individuals are just gone. So I wove this story of how, well, acupuncture could step up and would be able to help these individuals. Clearly, there's a need for it. And based on a lot of the research that we just heard about earlier in the hour, was able to provide support for that. So that's why I was interested in people, not so much in the acute stages, but in the chronic stages. Those individuals, particularly adults actually, who are now back in the community, who have had a traumatic brain injury, and they're still having some difficulties because of that. Was more interested in the moderate injury severity. We tend to categorize traumatic brain injury as mild, moderate, severe. Mild could be like a concussion, and we're familiar with people who have severe traumatic brain injuries. Those are the individuals that, if they live, then a lot of times they require some sort of skilled nursing. They're not able to just go back home. So these people who have a moderate level of injury are kind of squashed in between with the research to date. Either they're combined with people with mild TBI, or they're combined with people with severe TBI. And there's not a lot known about people with this level of injury. So because that's an understudied population within this population, that's exactly what I focused on. Now, why do we think acupuncture can work with that? Well, I'll refer you back to the first 45 minutes of this hour, why we think acupuncture can work for them. But we've discovered that TBI is viewed as a disease state. What does that mean? It means that once you have the injury and you after you go through your rehabilitation, you have a certain level of functioning. That's not static. Usually it does not improve, but actually a significant portion of people will decline over time from those rehabilitative gains. So it's not a stagnant state. So it's more like a neurodegenerative state, and it's progressive. So as you see here on the slides, about a third experience a decline from any recovery 10 years post-injury. This is true. This is something we didn't know many, many years ago because of lack of surveillance. And we know that the rehabilitation strategies are limited. And what I mean by that is nobody knows how much physical therapy somebody needs. Is it an hour? Is it 5 minutes? For how long? How many days per week? How many months? Do you have to revisit it? What about the people who start backsliding in their rehabilitative gains? Do they need more? That information just simply is not there. We have no clue about that for physical therapy or occupational therapy or any sort of rehabilitative strategies post-formal rehabilitation. And even then, as you see on these slides, these sorts of therapies teach compensatory skills. So, we help to, we hope to help somebody who has had a deficit as a result of TBI, learn to button their shirt again. We take that for granted, but sometimes it's very difficult. Somebody who's had a brain injury, and these rehabilitative strategies kind of teach people to kind of work around that. And same with cooking. There's a lot of modifications that has to occur. That's the current state of rehabilitative affairs right now. And it's not a small problem. Basically, a little over 1% of the American population, just in the United States, a little over 1% of everybody in the United States has some sort of disability as a result of a traumatic brain injury. So that doesn't include people who've had a TBI, but maybe things kind of changed, but they didn't realize that they actually have a deficit. They can't do something as good as they used to be able to do, but it's actually due to the TBI. This number does not include people in the military. So the number of individuals who have some sort of difficulties functioning day to day in some area of their life as a result of TBI is quite high. So putting all this together, this is where I kind of wove together. It's like, here's a large, there's a highly prevalent problem. We have a gap in the rehabilitative methods, and we think acupuncture can help these individuals. So along those lines, I had to kind of weave the story between pain compared to what the longest term goal is. And I haven't said what the longest term goal is. The longest term goal is to actually look at acupuncture for deficits in executive function. I want to be able to design an intervention and to be able to study whether or not we can help individuals with a disability as a result of TBI can regain some sort of independence in their daily living. And that requires looking at executive function. That funding isn't there right now. So looking at the most common sequelae from TBI, we have headache, but we also have depression and cognitive deficits. Now, you'll notice that migraine and tension type headaches are quite common. And once you hit a year, then approximately a third of individuals with TBI will still continue to have headache. However, double that is for depression and mild cognitive impairment. Still, because of this push to say acupuncture and pain, we focused on headache. Now, the literature portion of it, the research portion of it, this is why we need an evidence base. We never got to this point unless we had something that we could say, hey, this looks like this could work. And we know in animal studies, we just kind of went through everything at the top of the hour, but within these animal studies, acupuncture can decrease inflammation and scarring, it can increase synaptic plasticity, increase cerebral glucose metabolism. They should create an acronym for that one. And then neural cell proliferation and differentiation. We need an acronym for that one too. And within human studies, acupuncture has demonstrated an increase in the blood levels and oxygen levels in the brain. That's important because, if you're getting blood and oxygen going to the right areas in the brain, you would assume some sort of restoration. And number two, which is what Dr. Liu spoke about extensively, was about how acupuncture can target the brain networks. So this is something that's repeatable, and it's not something that it's just a one-off. This can be applied to, on average, most individuals. Now, but what we don't know is how is that in actual humans. These human studies, these brain networks, they weren't conducted, at least the literature that I had. It wasn't, I don't think it was on individuals with actual TBI. The animal studies definitely were. But I wove that all together and put together my little my initial attempt at a conceptual model here, which is quite straightforward, is, we're looking at chronic brain injuries. So we're looking down here at the bottom where it says tertiary trauma, where we have these neurophysiological effects occur. That's just where all the chronic stages of neuroinflammation, scarring, and impaired brain cell growth occur. And everything we just saw from all the other studies is that acupuncture can do X, Y, Z. Therefore, we would assume some sort of improved clinical outcomes. However, we don't know. We need to research it. Well, it got funded. And the objectives of the study, because this study is somewhat a unique study in the United States. It's not unique in other parts of the world, but here in the United States, it's a little unique. And because of that, the science is in its infancy here. So we have to demonstrate that this is even feasible to carry out. So that's why in this first box, the specific project that under which this grant was funded was to look at what's called a feasibility study. It's actually, this was more of a protocol refinement period. That's why I call it a pre-feasibility study, basically to test specific elements of the protocol that was going to funnel into the second box, which was the actual feasibility study itself, where we wanted to take a look at a randomized controlled trial of acupuncture to reduce headache, pain, and depression and mild cognitive impairments among persons with chronic moderate TBI. And this is all stepwise. So this needs to expand to the implementation phase. And there are a lot of steps that have to occur to get there. First, we've got to demonstrate feasibility. Then we have to demonstrate that, yes, we can even get what's a so-called signal with the acupuncture on specific outcomes. Then we have to demonstrate that we can run a study smoothly. Then we have to demonstrate that it's actually even effective at a properly what's called power trial, meaning having enough individuals in the study to see if there's any sort of an effect. Usually that size will be predefined. But then it has to expand outwards and be able to be implemented in various different settings and throughout the country. This is a long-term research project. Easily could cover a good 20 years. Now, this first box, the pre-feasibility portion of it, the rationale for it is that quite honestly, we do not know if individuals who have TBI in Seattle, because that's where I am, in Seattle, will tolerate the acupuncture protocol. We don't know that. I'm sure they can, but we can sit here and assume all we want to. But when we're asking taxpayers for hundreds and thousands of dollars to research it, we need to know. So this is part of that protocol refinement of, how often do you take your measures? How often do you can you do the needles that will be tolerated, and so forth. And then the implementation portion, even if when you get to the end, think about this. Here in America, the culture of America, most people, when they go to the hospital, you see all these big machines, all these computers, all these huge pieces of equipment, and we're going to walk in with a little bitty flexible blunt tip needle and say, this is going to fix you. I mean, I'm biased. I say yes, but you can imagine the perception of that from the patients and healthcare staff. So there's this whole thing about, will it even be accepted? Don't know. So this is a very this is why I say this is kind of a novel study, and is something that's in its infancy. We'll have to see over the years. So the outcomes, I just bring this up really quick because we always said that we need to demonstrate feasibility. Those are actually primary. If you go to clinicaltrials.gov, you will find this study on there. Just search by my name, clinicaltrials.gov, you'll find it. See a huge list of feasibility outcomes. But the secondary outcomes, of course, is the headache interference, and then measures for depression, mild cognitive impairment. And then we're going to conduct qualitative interviews, say, hey, what's working, what isn't? You know, maybe individuals want to be in a community, more of a community style acupuncture. Maybe they want private rooms. Nobody knows, you know, you have to ask. So this was the first step for that. Now, after all that, sounds great. So why does it say alternate projects? Well, COVID happened. We started recruiting, and we started recruiting at the beginning of last year. And very early on, we didn't need that many people to demonstrate feasibility, but early on, we were just getting our stride, and then all the COVID restrictions occurred. So, as you might imagine, it is difficult to administer acupuncture when you're practicing social distancing. You can't do it. So we had to suspend the trial, and it has stayed suspended ever since. Matter of fact, I'm going to have to close it down on clinicaltrials.gov probably within a couple of months because there's only a year left on this grant. It wasn't even until the end of November that acupuncturists in Washington State, as I understand it, were allowed to even treat individuals unless it was for emergency pain. Research doesn't fall into that because we were looking at community-based individuals with traumatic brain injury. We were using community-based acupuncturists. People had their own private practices out in the community. So I had to kind of pivot that. So a couple of studies I'm working on right now is they are exciting. They're just different methods. We are looking at a secondary analysis of individuals who have TBI and try to describe the characteristics of those individuals that has reported having acupuncture. But also send out a survey. We should be close to finishing the recruiting for it. And we wanted to assess individuals on paper, their knowledge, attitudes, and beliefs about acupuncture among individuals with TBI. All of that in the survey is directing the next step. My intent is to continue on, write another grant to do the feasibility study finally. Now that all the restrictions are lifting, these alternate projects are gathering preliminary data to say, hey, I didn't waste your $300,000 in the past 3 years. I actually used it, and we gather data, and can we go on? So that's what's going on right now. But what I want to speak to a more general right now is that there are challenges with acupuncture research, and this is something that's been talked about for many, many years, and we don't have a good answer. If we take a look at areas where bias could be introduced in a methodological design of a clinical trial. When I say clinical trial, I'm talking about living beings, some of them receiving an acupuncture intervention and some of them receiving some sort of other control. And specifically, I'm talking about humans. Clinical trials could, I'm going to reference human trials. So there are a good set of areas by which studies are generally assessed and whether or not there is a likelihood of bias, whether that's a high likelihood or low likelihood. There are 5 independent domains. One is the randomization process. Now with acupuncture, that's fine. We can handle that. We can keep the allocation sequence sealed. We can do the randomization. We can do it with third parties, and we can handle that portion. I'm going to skip over the second one, but the third one is missing outcome data. Well, every study suffers from that. If you're taking repeated measures over time, you're going to have missing data, but that's not unique to acupuncture. That's something every study has to worry about. And then measurement of the outcome, that's interesting. Because right now we have to rely on patient-reported outcomes. As you might imagine, clinician-reported or even just going for the gold standard, the neuropsychological evaluation and tests, those are very expensive. So we have to rely on how are things changing according to the patient's view. And that requires using well-validated patient-reported outcomes. In my case, we would be using the PROMIS measures, which is the NIH. That was a project by the NIH a long time ago where they wanted to take measures for non-specific types complaints that transcend diseases and medical conditions to know how patients feel they are doing, such as fatigue, such as pain interference, such as their feelings of depression. Now, if you are an acupuncturist and you have your own clinic, these are great to use because if they transcend diseases, then I argue that they transcend pattern differentiation as well. And so they are something that is perfect to use for acupuncture, whether in clinic or in research. Anyways, measure the outcome, we can handle that. And of course, selection of reported results. Well, of course, you report on what you said you're going to report on. The problems in the second bullet point is the deviations from intended interventions. And part of that has to do with the blinding and masking. Now, I don't care who you are. If you're an experienced acupuncturist, you know if you are inserting an acupuncture needle in a leg or an arm, even if you're blindfolded. You know. You have the experience, you have the surface anatomy, you see through your hands. You can't blind an acupuncturist. People seem to think that you can trick the participants if they've never had acupuncture before, whether or not they actually have a needle inserted. But you should be eliciting some sort of response, right? You should get to gee. Well, that doesn't happen with some of these sham acupuncture apparatus. So this is very difficult, and it's not unique to acupuncture. This is something that other biopsychosocial modalities have to contend with, like physical therapists. Of course, they have. I would think they have it a little bit easier because they can recommend exercises that look like the ones that target the specific muscles. But it's just enough different that they're engaging something else, kind of like a distraction test. Those tests that for malingering that you see in personal injury and workers' comp examiners do. We don't get that with acupuncture, but that is a significant issue. Is the lack of being able to blind acupuncturists and, for all practical purposes, the patients as well. But more so than that is the lack of a unified consensus of an excellent control group. What do you compare the acupuncture to? Now, in good clinical research, just with two arms, one with the intervention, one with control, everything except for the intervention should be the same between the two groups, just to put it basically. So with the intervention, there's time spent with the patient. Well, the control group needs that too. There's there's that interaction with the acupuncturist. The control group needs that too. Remember, everything except for the intervention should be the same between two groups. How do we do that? I'm afraid we have not come up with a good answer about what the ideal control group is for an acupuncture study, and we kind of got to figure it out. I was just going to use continued usual care because we don't have anything better right now. But better than that will probably be using some sort of attention control where people also go see the acupuncturist for an hour, but they don't actually receive the needles. It's still not ideal. It's not quite the same as taking a placebo pill and the Verum pill, the actual pill. It's not quite the same, but as a community of researchers, we got to keep striving to find a way. There are other challenges, and that was I believe some of Dr. Liu's work addressed this. He didn't talk about it today, but Dr. Liu's work in the past has talked about looking at pattern differentiation. And I think that we should decide that maybe we need to, in our inclusion criteria, people that we want to have in our study meet certain types of pattern differentiation criteria from a TCM perspective. That comes, that's hard too. How do we define blood deficiency? Well, it depends who you talk to. Well, who's the expert? We don't know. Which university claims to know what blood deficiency is? Don't know. But it's a good goal to strive for. And again, it's exciting to be in this field because we are at the very beginning of it and we want to be able to move forward with it. But there are so many unanswered questions right now that we have to, all of us here within this country and across the world, need to collaborate on. Because the idea of a control group, that's not just unique to America. Maybe Americans don't like the types of needling that occurs in other parts of the world. That's region specific, but a control group, that's something everybody in the world has to deal with. And so that's something that we all need to figure out together. All right, I am over time. So any questions? And if you have any questions, feel free to email me at that one right there, msodders@uwa.edu, and I will do my best to get back with you.
Yeah, thank you. Thank you so much. That's very interesting to hear, very enlightening. And then I was here perfect on time. That's very good control.
Okay.
And then, so now we'll transition to the Q&A. I'm not sure exactly how we should do it, structure this Q&As, but I would suggest we can, if you have questions, you can raise your hands and then direct it to either professors and then ask it in English or Chinese, and then I guess Jonas will translate the questions. Yes.
Yeah, I think people are already raising their hand in the chat room. So Kevin Kim.
Yeah, hi. Thank you for the talk. I have a question for Professor Liu, and it's sort of a two-part question. And it's how many people have access to the treatment of acupuncture, and how do the doctors decide whether to apply acupuncture? And sort of another part of this question is, so do some doctors disagree, and how do they settle this disagreement as to whether they apply the treatment or not?
Okay, let me translate this question for Professor Liu. So 这个问题有两个部分啊。他第一个问题是说，具体有多少人，他们如果有这个脑部的疾病的话，实际上在医院里能够接触到针灸的这种治疗方式。然后第二种方法是，第二个问题是在这个实际应用中，会不会有医生之间关于是否应该使用针灸治疗存在一些分歧？然后如果有分歧的话，他们要怎么样来决定到底是不是使用针灸的这种治疗方法？
好吧，我就直接说吧，好吧？就第一个问题吧，就是说，在那个像脑血管病，咱们脑卒中这块吧。在那个中国的这个治疗当中啊，基本上可以说是就因为我们中国的医院大家都知道有两种医院，一个是西医的医院，一个是中医的医院。那么在中医的医院当中，基本上所有的脑卒中的病人都会用到针灸的。要不你翻译一下
？So in China, there are typically we divide hospitals into two kinds. There are the Western hospitals and also the hospitals that extensively use traditional Chinese medicines. In the majority of Chinese medicine hospitals, people who have these diseases are indeed treated by acupuncture and they have access to it.
那么在中国的这个就中医的医院当中的针灸科，他的病人80%的病人可能都住院的病人都是中风的病人。
From my experience in China, in the department of acupuncture in Chinese medicine hospitals, about 80% of them are actually patients suffering from a stroke.
但是在针灸科里边，他不是说是全部都用针灸，他在急性期的时候肯定会用一些抢救的方法，像那个降颅压呀，来那个稳定这个血压呀。但是在这个恢复期的时候，一般他就会加上针灸，同时也会 根据病人的情况再配合上一些中药。
So, so in different stages, the therapy is different. Like for instance, in an emergency situation, of course, even the doctors in the acupuncture department will not only use the method of acupuncture, but they will also use other methods to stabilize the blood pressure of the patient in an emergency situation. However, in the rehabilitation stage, the doctors do use acupuncture therapy extensively, and also they combine the therapy of acupuncture with their medicines, especially herbal medicine in traditional Chinese medicine.
在那个综合医院，就是西医的医院当中，现在都有这个针灸科或者中医科，他们对这些中风的这些病人啊什么，他们都会请针灸科去会诊。那么可能在西医治疗同时，他们请这会诊的话，咱们针灸科的医生就去给他再用针灸的方法。
And also, even in the larger hospitals, like the hospitals that use Western medicine or modern medicine as a main method of therapy, they also have department of acupuncture in their hospital. And then for those patients who are suffering from a stroke, even the modern medicine doctors in China, they will also ask help from the acupuncturist, and then they will seek they will ask for the recommendation and suggestions from these doctors from the acupuncture department in treating patients suffering from a stroke.
所以现在这个从这个整体的趋势来看，就越来越多的在西医院里边的一些疾病，他们都请针灸来进行会诊。据我了解，有些医院他针灸科的这个会诊的病人，可能比他这个自己看的病人还要多，就是自己在外边他们针灸门诊啊或者病房看的病人还要多。
Okay. So to my understanding, that so two things. One is that these hospitals, they think they often use the therapy of acupuncture for patients suffering from a stroke, and in some cases, the acupuncture departments in the Chinese medicine hospitals, they see more patients from patients from other hospitals, like the hospitals that use modern medicine, because those hospitals are actually seeking help from the department of acupuncture. And sometimes they have less of their own patients, and they have more patients from other hospitals seeking help.
所以好像现在在中国吧，其实就是他们西医的医生他想用的话，他会请中医去看。当然现在吧，西医也提倡西医学习中医。但这个学习吧，一般需要学2年以后，他就可以用中医的方法，可以治疗一些疾病。
So given that the Western or doctors using modern medicine often need the therapy of acupuncture, they often learn from the Chinese medicine doctors. And the rule is that they usually study for a duration of 2 years before they are allowed to use the therapy of acupuncture on their own patients, and also other therapies in traditional Chinese medicine.
所以中国的这个大的一个政策，它叫中西结合叫中西优势互补。所以刚才说的这个互相之间这个问题不是特别突出
So in China, there's a general policy or general trend called the Chinese medicine and Western modern medicine being each other's complement, and also they have to use their advantage to help each other. So there's not really a disagreement between them, because they usually seek help from each other. This is the general trend.
Okay.
Okay. Thank you, Professor Liu, for the answer. Are there any other questions?
Yep. 喂，您好，刘教授，您好，好久不见。
你好，好久不见。
两个问题。
你好啊。
你好。我有2个问题。去年那个疫情的情况，有没有针灸医生给疫情的病人扎针？这是第一。第二，我听说现在在国内中医的地位越来越高，我听说习主席也推广中医，现在的中国老百姓怎么看中医？是不是越来越相信中医？And then I have a question for Mark. Is that okay? Also.
Okay.
Yeah. So.
那我还是用这个中文来回答一下 那个
哦
在中国吧，这次的抗击新冠肺炎当中啊，这个中医药发挥了非常重要的作用。当然，这个重要的作用吧，主要还是体现在用药物上。那个他们有了这个叫3药3方，这个3个药吧，也是通过临床的实践，现在已经变成了新药，通过了药监局的审批，FDA 的中国 FDA 的审批，成为这个新药。但是针灸在这个当中啊，发挥了非常重要的作用啊，这个我们也做了一些总结，比如在武汉的这个重症的病房当中，那么他就有很多的这个一些医生，中医的医生啊，他用针刺的方法啊来治疗这个患者的呼吸困难，哎，效果也非常的好啊，取得了非常好的效果。那么再一个吧，他们那个像上海的中药大学，他们的这医疗队，他就把针灸和药物结合起来应用，哎，效果也不错啊。他们是根据这个情况也是来一块用。那么像这个大家知道，在中药里边有个那个清肺排毒啊，这个颗粒，这个那个发明这个药的这个人，他同时还搞了一套针灸的穴位。他认为是这2个东西如果配合在一块用的话，
是不是张伯利教授？
啊，不是张伯礼，就那个葛佑文，他们那个清肺排毒汤啊，他搞的一套那个专门的这个用针刺，有13个穴啊，来和这个他的药物配合起来应用。那么再一个吧，咱们也用灸法，就像热敏灸啊，咱们江西啊中药大学他们用热敏灸的方法治疗了40多个这个患者，哎，也是效果也是非常突出。那么另外一块嘛，就咱们对着隔离的人群，就是有那个可能会发病的人群，他们呢做了那个专门的观察，就用那个艾灸的方法来给他应用啊，效果也不错。那么再一个吧，我们还专门做了一个研究，就是那个恢复期的病人啊，用艾灸加上拔罐啊2种方法结合起来啊，也取得了比较好的效果。那么这些文章吧。大家可以在那个感兴趣的话，我将来可以给大家推送一下啊，这方面呢也发表了很多的文章。那么至于在中国现在这个大家对中医药的认识啊越来越深刻了啊，越来越用的越多了。为什么呢？因为在中国大家也和国际上一样，深深的体会到这个疾病医学啊必然被这个健康医学所取代。而这个健康医学里边很大的一块，它就是要治未病啊，要预防，让小病不要变成大病。而中医药在这个方面，它的作用是被实践证明是非常有效的啊，因为我们那个治未病的理论和这个理念，实际在2000多年前已经有了，所以现在大家越来越多的在养生保健，在治未病，在疾病的治疗以及疾病的康复当中啊，来使用针灸，使用咱们中医药。所以我非常同意你的观点。现在在中国吧，人们对这个中医药的认识啊越来越提升了啊，而且找中医药的人越来越多。你像在广门医院，就我们中国中医科学院的广门医院，它每天的门诊量要达到1万人以上。在江苏省的中医院，它每天的门诊量，我那天去啊，它2万多人，所以这个看病的人还是很多的，所以我觉得中医药啊，肯定能发挥越来越多的啊。
Sorry, Professor, so would you mind if I give a brief translation for the question and the answer? Yeah. So sorry, so Dr. Flowers asked 2 questions to Professor Liu to answer. The first one is whether acupuncture has been used in the to fight against the coronavirus, which is a very huge issue now. And then for coronavirus, the most famous contribution of Chinese medicine is known as 三药三方, or like 3 medicines and 3 formulas. And then the FDA in China has now approved these as new medicines. However, we should also notice that acupuncture is also very important, and we have seen quite a lot of good effect from it. For instance, in Wuhan, in the emergency room, people have been using acupuncture to resolve the respiratory issues of these of patients who are seriously sick. Also, the doctors from Shanghai, they're combining the therapy of acupuncture with other treatments, and they see very good results. And also, there's Professor Ge, who's the inventor of a medicine that helps with the lung. He also worked on a set of acupuncture points, a set of 13 points, which should be used in combination with the medicine to help the patients. And also, Professor Flowers asked a question about whether people in China now accept the use of traditional Chinese medicine and whether people really like it. And the answer is that really there are a lot of people seeking help from the traditional Chinese doctors. And for instance, in one of the Chinese medicine hospitals, Huanmen Hospital, in each day there are more than 10,000 people going to the hospital seeking help from the traditional Chinese doctors. And also in the province of Jiangsu, in one of the hospitals, there are more than 20,000 people seeking help from traditional Chinese medicine practitioners per day. So we see that there is really an increase in people's understanding of traditional Chinese medicine, and also an increase in its popularity among the common people of China.
Awesome, Jonas. That was a wonderful translation, I have to say. Well, Dr. Flowers, you have a second question for Mark, right?
Yeah, for Dr. Sodders. So thank you for your talk. So I'm really fascinated that you're funded by NIH, because also Z will tell you that in our class in Hopkins, we started off by debating whether the NIH should fund the research into complementary medicine, including Chinese medicine, and people like Z agreed that we should. So you're one of the beneficiaries of that. So that's good. So I'm wondering, so there are people on the pessimistic side and optimistic side. So some people think, oh, we're never going to persuade the Western scientific community, but you seem to be on the optimistic side, which is good. And then, so I was wondering how you see the research into the future. You sound quite optimistic. I mean, with the personalized medicine, so there are two factors. One is personalized medicine, individualized medicine is becoming quite the trend in scientific circles, and also the perceived failure of Western medicine to really deal with the pandemic until we got a vaccine, but there were actually no treatment. So do you hope, can you talk more about whether you're optimistic or pessimistic? I think we have a new director, Helen Langeveen. I don't know if you know her, but I think she's very active.
I met her at the Society for Acupuncture Research, the last one that was in person, which was 2 years ago. Well, just let's make sure we want to be specific about the funding agency, and yes, NIH, but it's the NCCIH. So it's at the
embedded in NIH, right?
Yeah, but the NCCIH used to be NCAMS, and they changed names now. And if you wanted to know what their acupuncture research priorities are, they have that up on their website. They talk about, okay, our primary priorities for acupuncture, of course, it's pain. It talks about a few other things as well. But I am optimistic, and here's why. I've come from the viewpoint that the data don't lie, but we need data. And all it takes is just a few people to get their foot in the door and start conducting these studies.
Like you.
Well, I'm the beneficiary of the others have come before me too, as we all are. The people that like at Harvard, we have
Lisa Conboy or whatever her name is.
I know that name, but I can't think of her exact name right now. But I was thinking of Vitaly Napido.
Oh, I see.
Vitaly Napido, and is it McKenzie? He's in New York or something like that. But there are a few prominent scholars that are conducting acupuncture research, but there needs to be more of us. Yeah. What I'm optimistic about is if we have enough data on specific areas, then we have a better chance of having it assimilated into the healthcare system. That doesn't mean we have to give up our TCM roots. It just means that we have to be able to present it in such a way that is faithful to the medicine, but also is in a language that can be accepted by the dominant healthcare system. Along with COVID and what have you, there are some researchers that have been collecting case reports are very important, especially in the United States. Case reports serve two purposes. One, to describe a new phenomena. Think about HIV and back in the 70s from the LA pharmacist. That was a case series. The Zika virus, I think that was a case series as well, not just a case report. But also it's to kind of show an alternate view to the dominant view. I remember when I was when I was first in just my master's program here in the United States, the first clinic I had, I treated an elderly gentleman for pain because of diabetes, but also macular degeneration. And I thought, well, the pain will get better. I don't know so much about the macular degeneration. Well, sure enough, four treatments in, this individual started having spells of being able to see again for a few hours at a time. And that was amazing. But we take it for granted being acupuncturists. We see sorts of things that happen and we're like, well, of course it did that. But all of us can be writing case reports and publishing those case reports. With COVID, with COVID in particular, I think at HealthGot out here in Portland, just a little south of here, there was a huge database, people trying to collect data on acupuncturists that were treating individuals with suspected COVID or confirmed cases of COVID and their results to put together that evidence base. I think with a concerted effort with people in research, but also clinicians with what they can do with our case reports and case series, if we can collectively start building this evidence base, it goes back to what I said at the very beginning of my answer. The data don't lie. And that's something where it'll give us a nice chance of being more and more part of the mainstream.
Thank you.
Did I answer your question fully?
Sure. Yeah, I get where you're coming from. Yep.
Thank you.
I think right now, I think it's a good time to put a pause to this since we're approaching the 9:30 time. And then if you have any other questions that's not answered today, feel free to send those questions to either one of the members on the board or just to our group chat. And then we'll be sure to forward those questions to our speakers.
Or you can contact them directly. I think Dr. Sodders lists his email. And then, well, if you want to ask questions to Professor Liu, you can do that too. And then, yeah, so thank you to both Dr. Sodders and Professor Liu today for showing your research. And it's really interesting to hear. And I can't get enough, and I still have a lot of questions I might reach out to in the futures. So, 谢谢刘教授. Okay. So have a good night, everyone. Hope you enjoy it. And then, yeah.
Okay, thank you.
Thank you.
Bye.